We are live. Hi, good evening, everybody. Welcome to our Seniors Real Estate and Services video series. I'm Sandra Roman. I'm a real estate agent with Keller Williams. I'm here in Long Island, New York. And today, as always, I'm with my friend Denise. Hi, Denise.
Hi, Sandra.
How are you?
Good. How you
Busy?
doing?
Busy?
Busy. Yep, busy. The spring selling season is in full swing.
Good.
Yes, very busy. So we are bringing this live broadcast to you every Wednesday for 4 more weeks after this one, for a total of 6 weeks. And it's just a senior services series. We just want to get information out there to the public, to you people, so that you're aware of services and things going on to help you out. I am a senior real estate specialist. I have specialized training in senior real estate matters, and I was also in the healthcare industry for a very long time, dealing with seniors. So I'm with Keller Williams Points North as well. And you can find me on Instagram, Facebook, Denise Lanzarone, your local realtor. Instagram, Denise Lanzarone. We always appreciate it if you support us and like and comment. Gets us more hits on our posts and things. And tell us more about yourself, Sandra.
About myself, I already did it all.
Okay.
Now, you can find me on Instagram and Facebook and YouTube as Sandra Roman Real Estate. If you're watching us on YouTube, please click the bell or ring the bell, subscribe to my channel, comment and share if you know somebody that might be interested in this kind of information. And remember that we are live on YouTube, on my YouTube channel, Sandra Roman Real Estate. We are live on Denise Facebook page as Denise Lanzarone, and on my Facebook page, Sandra Roman Real Estate. You can find me everywhere at Sandra Roman Real Estate. Please remember, if you we have this booklet or this PDF file that we are sending out. If you want more information about our guests, we have the all the information from our past series and all the information we're gonna have from the new guests that we're having on this second season of us.
Season 2.
Season 2, we're having a link below on the comments box or on the description box, whatever. So you can click, leave us your email, all your information, so we can send you that PDF file if you want to have that information all together in one place. Just contact us. And today we are having a very special guest. She is going to talk about what, Denise?
So we have with us today Daria Gentile from MX Elder Care, and she's going to talk to us today about Medicaid and long-term health care. And
welcome to our channel.
Hi guys, hi ladies. Hi. Wonderful. This is wonderful. Thank you so much for having me. I love what you're doing, as I had mentioned before, and I'm grateful to be here and to be able to share a little bit of information that may help someone, right? Especially our seniors and their families on Long Island.
Yep, that's what we're here for.
Yeah, where they can find you, Daria?
So I do have a personal Facebook profile under my name, Daria Gentile. As you said, I love the way you say it. Like my husband's family says Gentili, but I feel like that's so many syllables. So Gentile flows so much better. I like that, Denise. Thank you. And you can also find a lot more information about what we do at our MX Elder Care pages, both on Facebook and Instagram. And on Instagram, my personal profile is Daria's Roundtable.
Oh.
So
why Roundtable?
Why Roundtable? Great question. So I think I might have told Denise this. I'm not sure. But a little bit, probably about a year and a half ago, right at the beginning of COVID, not because of COVID, I was going to do it anyway, but I put together a little bit of a Facebook group with the encouragement of some of my colleagues and friends who thought it would be a great idea. And I love the idea of a round table because I think of just everyone pulling up a chair to a round table and just having a discussion like we are right now. And so I believe in the same kind of platforms as you ladies are providing, where especially for women, no negatives on the men or anything
No
like
negatives.
that, but I have some gentlemen come on to some of the presentations we did, but I try to highlight others in what they're doing, bring people together so that we all can learn, connect, and grow. And that's kind of the philosophy of the roundtable. So my MX Elder Care work and our pages are very much intertwined. But if you do visit my profiles, you'll also see that I'm a crazy Zumba lady. So
That's
great.
good. And tell us a little bit about MX. What is that MX do?
Thank you for asking. So MX Elder Care, we are board certified Medicaid planners and senior advocates. I know that's a mouthful, right?
Yeah, it's a lot.
So board certified is more of a somewhat more recent designation. We've earned that and been awarded that by our expertise and our education in the field of Medicaid planning. Definitely having been in the field with, result-driven process and progress, proven track record, and don't forget the certification to be board certified, like a doctor's board, part of the board. You do have to pass a very thorough, difficult national certification test.
Wow.
And then being part of the board, you're answering to a higher power. I mean, you have to uphold, the highest standards in your practice. So I believe it gives the community and anyone who would want to work with us a little bit more peace of mind in knowing that we've achieved that, and that we have a board backing us, and that we're answering to an authority in the field.
That's great. Yeah. Good to know.
Yep.
And I have a question. I always have a lot of questions, but I have a difficult time understanding a lot of stuff, of course. What I would like to know, what is the difference between Medicare and Medicaid? Because to me, it sounds like the same.
So that is a very big question. And it's sometimes, I think, in our field in healthcare, it's overlooked to spend the time to really clarify that. But I think it's super important because it's confusing. I was confused. Okay, so let's set the record straight and let this be on video. So if someone doesn't get it the first time, they can replay it a lot of times. Okay. So Medicare, everyone's heard of Medicare, right? And when you think of Medicare, what do you think of? Benefits when you become a senior, healthcare benefits when you become a senior. So how you come upon getting connected to Medicare is you either are 65 or over, right? And you do want to make sure that you're enrolling and looking into this a few months before you turn 65, because you don't want to not connect and then have penalties. And I don't know a ton about that, but if you want to know more about Medicare, I can definitely get you a couple of experts on that.
You can get penalties? What?
If you don't, depending upon, your situation. So it's always good to have, again, guidance from a professional, like you guys are professional real estate agents working with you're certified to work with seniors, which is a very unique and, unique piece. So back to Medicare. So you get that when you're 65, or you also may be on Medicare if you're legally blind or legally disabled. Okay, now Medicare
no matter the age. If I'm legally blind,
yes. If you are under 65 and have been legally deemed legally blind or legally disabled, you will then have Medicare as your primary. I know you guys have heard that word before. What is your primary insurance, right?
Okay,
and that would be your primary. Okay, Medicare program is federally funded. Okay, it's a federal program. Now, just to add one more piece, that will cover your daily health care, your doctors, your hospital coverage. There's some additional things you can subscribe to beyond that, but it covers 80%. And of course, there's always certain criteria for each and everything that you may find yourself needing to use your Medicare benefits for. So of course, it's important to understand those plans. But for the things that are not covered by Medicare, most, I would say, add a supplemental policy that they pay something for, and that will generally cover the additional 20%. Now, some may come from fields where they've gotten a different type of benefit and they're getting that covered some other way. There's all kinds of different scenarios, but I hope I did a good job of explaining. And Medicare, now I know you're asking me to talk about Medicaid, and we're going to get to that, but I want to be clear. Medicare is always your primary, even when you then have Medicaid. Okay. So always Medicare is your primary insurance.
Okay. And then Medicaid?
So that's really a loaded word, even more than Medicare. And the reason being is because when the average community member, our average population, hears the word Medicaid, what does everybody tend to think of?
Low income.
Oh, say again. Go ahead, Denise.
Low income.
That's for the, people that can't afford healthcare, right?
Right.
And while there is a program that serves that purpose under Medicaid, Medicaid has many programs under the Medicaid umbrella. Okay.
Oh, okay.
So
it's a big umbrella with different little things.
Exactly. So I'm going to keep it simple. So there's CHIPS. It does stand for something, child, right? CHIPS is for children that are under 18, that no questions asked. If they don't have and they're not covered by their parents, they will be covered through CHIPS program, which is under the Medicaid umbrella. Then there's mainstream Medicaid, what we call mainstream Medicaid. And that is the Medicaid that will provide your daily health care for anyone under 65 who cannot subscribe to a healthcare plan through their job or through their family or any other way that they might come upon it. So then they would be going to what you've heard of as the marketplace, and they would be able to get insurance that way. And Medicaid, mainstream Medicaid, is going to depend upon your income level. So this is another big difference between the Medicaid that we're going to talk about in a moment, which is the Medicaid program that I and my company, MX Elder Care, works within, which is your long-term care. But just to finish up, the mainstream Medicaid program is an income means tested program. So what that means is if your income is under a certain level, you would qualify for the various marketplace programs. And the big thing, the big little caveat that's important is that program is not recoverable. So what I mean by that is if you're under a certain income level and you subscribe to mainstream Medicaid and you're receiving benefits, it does not matter if you own a home, if you have assets. You could have very high amount of assets. You could own a home, and that's not what they're going to use as a means test for mainstream Medicaid. They only look at income from the year prior. Yeah, from the year prior for the following. Okay. Now, I'm going to stop for a second and see if you have any other questions about that.
If somebody have questions and they are watching us live, they can write their comment. We're going to see their comment. Their comment here. We have like a little comment thingy, so we can see your comments.
A little chat.
It doesn't matter where you are. If you're in Denise's Facebook or my Facebook or YouTube channel, write your comment and we'll read it aloud here for you.
Okay, fantastic. So if you guys don't have any questions, I'll go on to tell you that long-term care Medicaid is the program that we work within. Okay. So what is long-term care? Long-term care is a big phrase that essentially means you're going to need this care for the rest of your life. So it comes in the form of home care. It comes in the form of, it could be skilled nursing, which we would all know as a nursing home. It could be, the community-based programs. There's more than home care. There's others that can allow you to be in an assisted living with Medicaid benefit. So, you know, there's a variety of things. But Medicaid, unlike Medicare and unlike mainstream Medicaid, you need to really make sure that you're speaking with a professional, especially having to do with the financial aspects of it, because it is a recoverable program. And what that means is if you don't work with someone, again, I always say a professional, to do proper planning and get the guidance that is, you know, that you need, and things are put in place properly, and the home is protected, and assets are protected, and income is preserved in the right way as you're going through the eligibility process. Later on, if you receive benefits because you fall into the program somehow and you haven't done the proper planning, Medicaid for long-term care program that I'm speaking about, home care especially, can come back and recover against those programs. So it's very important. I know that's a lot and it's a little confusing, but just know that Medicaid is also federally funded and state administered. So every state has different criteria. I will tell you the good news for New Yorkers, the Medicaid program right now is probably the best, the most, I would say the most robust out of, you know, all of the programs in the different states. And there's all different criteria and different levels of, you know, what you would need to do for qualifications. So, yeah.
And how do you qualify for that?
So, so there are income and asset qualifications per individual and per couple. If you're, you know, if you're applying together, there's a variety of solutions that we use, and all will depend on the goal that the family has for that patient or that couple or the husband, you know, whatever it may be. And depending upon, and there's different options, right? So depending upon, you know, how that all goes. But for now, let's leave it at, it's a little over $900 that you're allowed to have allowable income. Anything over that would prevent you from naturally becoming eligible, but it would not prevent you from planning to become eligible. Do you guys understand that? What I mean by that?
Okay. Explain me as if I was 4 years old.
Okay. So if you have over $934 in income monthly, which, as you know, living on Long Island, if you don't, you're probably going to have a tough time, right? Most people do. The clients that we work with generally have a few $1,000s in income monthly and have, you know, hundreds of thousands a home. They have some, you know, money in the bank, investments and things of that nature. They're middle class. They've worked their whole lives, right? So anything over $934 in income, you need to plan. You need to work with a professional that's going to preserve that income with certain tools and solutions that allow it to remain with the family and used the same way you would use it for your expenses now, but it's done in a way that allows Medicaid eligibility. Okay? And it's done, again, doing this with a professional. There are certain tools, and I can use, you know, there's trusts that are used. There's some trust for income. There's trust for assets. And again, not every scenario is going to be the same. There's going to be some that won't need all of that, right? So depending upon, that's where the consultation is so important.
Yeah.
So, and then on income side for an individual, it's, you know, just under 16,000 that you're allowed to have an asset. So you can keep that exposed, but anything over that, there are a variety of solutions that Medicaid planners certified as us, certified Medicaid planners use to protect that income. So again, it remains with the family so that it's safe.
Okay.
And yet it allows the patient, let's call it, because they're the ones that need the care, to receive these benefits, to become then eligible and approved. And the beautiful part of all of that is they can receive the benefits they need and get the care they need. And I'm going to tell you why it's important, because of the cost, right? But the beautiful part is that their legacy, stays intact. Because look, it was never intended, and no one ever wants to work their whole life. They work 40, 50, sometimes more years. Families have accumulated their own home. Maybe they have a couple of $100,000 in the bank, some investments.
Yeah.
They've got their Social Security, their pension coming in, and they're living off of this. And what does a senior tell us they want? Nothing more than to pass these things along to their children and their grandchildren, right?
Mm-hmm.
It was never intended to get to the age of, let's call it 70 plus or 65, whatever, and you're failing in health and you need some care at home, and you're finding yourself having to pay for these things out of pocket, not knowing when you'll run out of money, worrying if you're going to go broke before, care is still needed, worrying that your family is going to be burdened by all of that, right? So if we can protect and preserve these things and do that up front and get them care through these programs that they are entitled to, just like all seniors get Medicare, all
Mm-hmm.
seniors get Social Security. This Medicaid long-term care program is a program that everyone that's worked has paid into their whole working life.
But
So
I have a question right now that I always ask, because I have that. For example, me, that I told you that my father was diagnosed with Parkinson's like a year or two ago. What do I do? Because right now he's at home. He is doing okay, but the condition is going to get worse, and then he's going to need care at home or other accommodations. What do I do in this case?
So in this case,
what's the first step? Call you and make an appointment?
I would say that we are really a great place to start, and I'll tell you why. First of all, our consults are free. If families call me, I'm listening. I'm trying to understand what it is how I can help, who I can, if it's not me, who I can refer them to. But I'm very, very well connected in the healthcare industry for seniors. So I know you guys are real estate, so you stay in your lane, right? I wouldn't go sell someone's house for sure. But or attempt to advise them on that. I would send them to you. But in this case, any type of care, they're facing the reality that care is going to be needed for the long term. Yes, they should be calling me, because we can help them understand what their options are. We can point them in the right direction. We can provide options and see if it makes sense for them to work with us. We'll definitely take them on as a client, no question about it, right? But most importantly, I'm going to, or our founder, Guido Durley, is going to get them to the resource that they need, which often happens, in healthcare. We're referring out to a very close professional partner that may be able to provide them with exactly what they need. But
because usually long-term care, it's expensive.
I'm glad you touched on that. So yes, and let me share why this program is so invaluable and why people need to reach out and get the right information from someone who knows and understand these things exist for them.
Mm-hmm.
Is because if you need, and I'm saying full-time, because I'm going to use some round numbers, right?
Mm-hmm.
If you need full-time care at home, so full-time, 8 hours a day, or sometimes there's a live-in needed, 7 days a week, you are looking at $10,000 a month to pay for that care. It's $30 an hour. Do the math.
Yeah.
Okay. So 10 hours a day, $300 a day, right? Times and anything. So even if it's $5,000 a month, even if it's half of that, right? Still a lot of money. And you can go through money very quickly. Okay.
Yes.
Secondly, long-term care in a skilled nursing environment is anywhere from $13,000 to as high as $18,000 a month.
Mm-hmm.
And there are folks out there that have a home, have resources, assets, income, have never done anything to protect these things. And if they find themselves in a situation where they're faced having to transition into a nursing home, the first thing they need to do is call a Medicaid professional. 100%. We can save, worst case scenario, we can save half of everything. There are some stories out there where people are relinquishing their entire legacy over this, over finding them because they're not getting the right professional help.
I have a question here. Can you read it, Denise, with your better English than mine?
Yes. When you was talking about professionals, Diane wants to know if you're referring to an elder care attorney. Furthermore, in my experience, the paperwork, trusts, irrevocable trusts are very expensive.
Did you say her name was Diane?
Yeah.
Diane, that's a great question and some terrific feedback. So yes, an elder law is a definite option for sure. They are a professional. If they understand and work within the Medicaid programs and they're versed in that, I would say that's a great option. But we're the alternative to an attorney. So we are not attorneys. However, if a legal document is needed, we do have an attorney or two that we work with. What the good news about that is, answering part 2 of your question about it being very expensive for these trusts, the attorneys that we use, they're typically sole practitioners and they work with us and we give them a high activity level in doing these types of documents. So they give us preferential pricing and we pass those savings along to the families. So you will find for the same trust, that you could pay, $7,000, $8,000, $9,000, $10,000 and up from an attorney. With us would be a fraction of that cost. And we're really very much more focused, if I could just add, again, like we were speaking about earlier, Denise and Sandra, in the long-term Medicaid field. So we don't, elder law, and there are many elder law attorneys that do a fantastic job of Medicaid, right? But some of them are focusing on a lot of other things as well. We just focus in this space, and it gives us an opportunity to offer what we believe to be a much more guided, supported, and complete process, because we're helping with preparation and documentation at the beginning when families are struggling with that. And we're also getting that care in place, and we're advocating. The senior advocacy piece to our business, to our practice, provides a much greater outcome in the benefits that the person will receive, that the patient and the family will receive from Medicaid because of that.
So you also mentioned to us earlier that you also take care of getting the care in place after they get the Medicare. So that's, I wanted to explain it to Diane and to everyone else as well.
Great. Yes, and we do. And so that's something we're working on at the beginning. When we first speak to a family, our first goal is to get their care in place as quickly as possible, achieving Medicaid as part of the solution process. So we're working behind the scenes from the very beginning when we take on a family to get home care in place. We have certain partners that we work with and strategies that we use to get caregivers in place, so that when we're meeting care with discharge, if they're being discharged from a rehabilitation center or, wherever, a hospital, if that's the case, we're meeting care with discharge or anything, as quickly as possible is the goal, obviously, to get that care in place. So, yeah.
Clarita, I'll send you the email. Besos, Clarita. I'll send you her email.
I already put it in the chat.
Yeah, but I think she didn't see it, maybe.
Oh, okay.
Yeah, I'll send it to her.
I was just going to ask a question. Now you got me confused.
Sorry.
That's okay. So how early should you start planning something like this?
Yeah, like 50, 40.
Another terrific question. So, I would say if you're healthy, or the family, if you're thinking of this for yourself, right? Mm-hmm. You guys are young. So
and beautiful. Healthy, don't forget, I'm beautiful.
You are young and beautiful. Yes, you are.
Young and beautiful.
Inside and out. And, if you are under 65, not on Medicare yet, and you're finding yourself feeling like you'd like to get things in order, you'd like to understand more about what your financial picture looks like, and begin to talk about getting these things in place to protect and preserve them, you can still call us. We would refer you to our attorney that we use for what we call estate planning.
Okay.
But if you are either, like I said, disabled under 65, or you're on Medicare and you're finding that you're needing some care. So if you're looking at your activities of daily life, bathing, dressing, any kind of, showering, bathroom activity, cooking, food shopping, light cleaning, things of that nature, and you're struggling with any one of those or a multiple of those, that is when long-term care is beginning to become a reality. And right away, you shouldn't wait, because the idea is you don't want to be in a crisis when this happens. However, we shine in a crisis. So I know I'm saying a lot of different things, plan. Don't wait for a crisis,
but we shine.
That kind of thing. And, a Medicaid planner it comes through in a crisis very well. So it's also it's never too early to plan, Denise. And,
okay.
and that's one of the we're planning right now by getting this information out there.
Exactly. Yeah. What about someone who is disabled, who is, due to a traumatic injury? I have a brother-in-law that has an issue, but would you be able, he's in a facility right now for rehab. What would you be able to do for him?
Great question. So, you said he's legally disabled?
Yes.
Is he under 65?
Yes.
And he's legally disabled. So it's definitely a conversation that I would want you to have with our certified Medicaid planner, who happens to be our founder, Guido. And I don't know if he's listening to this right now. I did let him know we were going to be on. So, okay. But absolutely, if he wants to, whatever the best options are, if he's looking to come home, Denise, there are programs that provide nursing home level care at home that we work within. So there are different waiver programs. So yeah.
Okay, great. Good to know. Thank you.
So yeah, I'll connect you with him, and it's a conversation, and you'll learn from it, and then you take it from there, one step at a time, and we'll help you as much as we possibly can.
Yeah, you're getting darker and darker, Dad.
I know. I see that. Hold on.
Turn your lights on. Now we can see you.
You guys are gonna laugh. I'm still a little mysterious, but it was so bright and sunny out here. I'm in my sunroom, so I'm literally outside, but I'm inside. So I don't have a ton of light, but you can see my light there. But hopefully that was a helpful answer.
Yes. Diane says she's very important, Daria.
Diane is, or Denise is?
No, Diane is saying that she's very important.
She says I'm very important.
Yeah, we are all important, and at the end of the day, we're our biggest advocates. But
yeah,
but learning and knowing what resources are available, and it's so important. So I will put myself out into the public anytime anyone, like you wonderful ladies, have asked me to do this, anytime I can. The reason that I got involved in this work is because both my mom started at a relatively young age with dementia. And 7 years, and it was it's very, very difficult to watch if you guys have experienced that. I know Parkinson's, same type of thing, not very, very difficult to watch, very hard on the family, hard on the patient. Yeah. And then my dad later on. So they're both gone now. But when I found out about Emmix and I was introduced to Guido, I said to myself, this is definitely something that because I love educating, this is something that people need to understand from a really verified source, and that they can feel comfortable with. And if it's not me, I just urge people, get the professional guidance. Don't be afraid to do that. That's why we do free consults, because we want people to get the right information, be able to pick our brains a little bit.
Yeah,
right?
it's the same thing we say with real estate. If you want to sell or buy, go to us, go to any other agent and have a consultation. We are like the colors. Maybe we are all beautiful, but not all the colors match together. So maybe you don't match with me, you don't match with you, but there's somebody else that may give you the advice and the help, right? But they need to go with a
True.
professional.
Yeah,
So
absolutely.
true. Yes, and
Absolutely.
yeah, that's it. At the end of
I
the
was
day.
watching I was watching one of your interviews, of course. I told you that. What is you were talking about myths and things that people think that it is and it is not. What is Medicaid and what is not Medicaid?
Yes. So there's a lot of misinformation that is said about these programs. As I started off this discussion tonight with you guys, the fact that right away people hear the word Medicaid, it has a little bit of a stigma attached to it. People think they're a little. Sometimes pride gets in the way. I mean that in the best way, but it's or they're thinking, oh, this is not for me. This is for the people that can't afford care. I'm not in that category, and they're just not understanding. So there's a lot of, and then they're hearing things from friends. Friends are having discussions about these different types of things, and oh, Medicaid, long-term care. My neighbor has, someone that comes to the house and they don't pay anything. Oh, that I can't have that.
Yeah,
I
but
have
your
2 kids
friend
on
is
my
not you. You
Mhm.
are
correct.
different situation, different circumstances.
Again, who are they hearing this from? They're hearing this from not the professionals that are living in this field that have certifications for the work that's been done, as you guys do with your I know Denise is a senior real estate specialist, right?
Mm-hmm.
So again, you want to find the expert that you're comfortable with. And so these myths can be dispelled, because many people believe that they can't qualify for these programs. Anyone can qualify for long-term care Medicaid. It
They just
doesn't
need to
matter.
plan.
You just need to work with a professional to do what's called Medicaid planning. In our case, we also help with every stage, and we get the care in place as well.
Mm.
And if you find yourself in a crisis situation, and you're faced with having to pay for care out of pocket, because there's only 3 ways to pay for care. I don't know if we didn't touch on this.
No, we didn't.
Pay privately, which means you're paying out of your own bank account, which we talked about. You heard the numbers that I mentioned, right? How high? 10,000 full-time care at home, 10,000 full-time care in a nursing home, 15,000 and up, right? Roughly speaking, monthly. So think about that yearly, how quickly you would go through your money. So
Yeah.
a middle-class person, right? Think about that. So private pay, or there are some cases where individuals have taken out long-term care policies, long-term care insurance that they're paying for, right? They're paying for these policies. And you know what? That's great. However, every policy is different. There are some disclaimers in these policies. There are some caveats in these policies. There are exceptions in certain policies. And a lot of times, the benefit that's being dispersed by the policy does not cover the care need in 2022, because costs are so high. So we've actually had clients that have sort of dropped their long-term care, and we've helped them connect to Medicaid. So pay privately, long-term care insurance when it's a good plan and it will work for you, right? And there are cases, that is working. And if you don't have either of those, the answer to long-term care is long-term care Medicaid programs.
I have another question. Let's think that I plan for my Medicaid thing. Do you give me like a paper? Do you give me something for the planning? Or if when I need the care, how my son can find out? How
Yeah.
does
So
how that work?
how does our process work? So usually clients will speak with me first, right? I get referrals from many different places in the community, other professionals, the rehab centers, sometimes friends, people that know that I do this on Facebook, my Zumba friends ask me questions and so on. And they'll speak with me and I'll help them gain an understanding of the basics.
Mm-hmm.
Then they'll go next to our certified Medicaid planner, who is Guido, who's the founder of our company as well. And they'll have a more in-depth consultation, which will dive deeper into their specific situation on the care side and on the financial side. At that point, he will let them know, obviously, there is a cost. We're a for-profit company. However, I believe the value of what we represent for families is well worth it when you consider what you would be paying privately monthly for care. Our fee is well less than that, and it's one time. So if you think about having to pay let's call it $5,000 to $10,000 a month over month, 12 times a year,
that's a lot
for
of money.
home care, and you only had to pay us once, a portion of that once, and your then care is paid for through Medicaid programs, it's well worth working with us. And at that point, he will let them know, depending on the work, the program, and the work that needs to be done to accomplish eligibility and approval. And that has more to do with what's going on their side of things in terms of where things are placed, how many strategies we have to use, how many solutions we have to put in place. And again, the work that has to get done to do that. It has nothing to do with the amount of what they have, has nothing to do with it. I mean, in dollars is what I mean. Okay. But then at that point, he would let them know on the phone what our fee would be. And then we would send out some documentation, which we call our engagement agreement. And that would have the details of everything inside there. And from that point, typically we're speaking with other family members. If we're talking about a senior, we involve their kids. We'll do a Zoom to make sure everybody understands. Or there are times we meet in person if folks want to understand. And then we just start working on the case. We have a team behind us, a wonderful team. We have a professional team of care coordinators and care placement. We have a social worker that's fabulous. And we also have our preparation and process person who does just a tremendous job working day to day with the families to help them get everything together so we can move the case forward and accomplish approval for them. And then we're working behind the scenes also on care placement, as I talked about. Okay. So that's what would happen in the process. We have 4 stages to our process after consult. It's preparation, planning, which is, like I said, the financial and the care planning. That's kind of hand in hand. Those go hand in hand. Processing and placement.
Okay.
Diane wants to know if a family member calls, do they ask to speak to you?
Yes, you can absolutely call me and speak with me. We cover all of New York City boroughs, parts of Westchester, and all of Long Island, Nassau and Suffolk.
Tell them your phone number.
631-214-9613. And my email address is Daria, DARIA .Gentile, GENTILE at emixeldercare.com. So EMICS elder, ELDER, care, CARE.com.
Call now.
Well, if I call now, I'll be like having a conversation while I'm trying to
call now. Well, not call in 5 minutes or 10 minutes or something. Denise, something else you want to ask?
No, I was great. A lot of information. Medicaid is probably the most misunderstood thing out there.
I didn't know a lot of things about that.
Yeah. So
it absolutely is.
It's great to know that you have a professional to go to figure it all out for you. It's wonderful.
Is somebody in the watching the live have a question? We're going to be here for another few minutes. You can.
Yeah, we actually have. Wow, we were long tonight. So
yeah, we talk a
lot. Yeah, lots of great information. We are continuing our series next week. I'll just tell you about that while we're waiting to see if anybody has questions.
Yeah.
Next week, our guest will be Diane, who's asking a lot of questions tonight. Diane,
Now she has the
you guys can
opportunity
come
to
on.
talk a lot. Yeah.
You can come on next week and ask her a lot of questions.
Yeah, come next week, Daddy, and ask her a lot of questions.
Diane is an occupational therapist, and she also runs a decluttering and organizing business. So she's going to discuss some safety issues at home, preparing the home for elders, medication management, things that occupational therapists help with elders in their home, and also talk about decluttering and organizing the home, because that's, we find that as realtors that's a big issue when these seniors are looking to sell their home. They have so much stuff.
They're not seniors.
Yeah. So that's
why I'm trying to clean before I become an actual senior. We're trying very hard to get to clean out stuff, because I know it's hard. It's really hard. It's
I know, especially when they've been in the same house for I don't know how many years. My mom has the house with a lot of stuff that when we were little, and I'm like, Mom, let it go.
These things have a lot of memory and symbolism, and they're near and dear to their hearts, and it's hard for them. It's time goes quick, and you don't realize how quick it goes. I'm sure you ladies can say that looking back, right?
Yep.
So
definitely. Denise, before we leave, people have a lot of glass. Well, yeah, glass and everything. Chinas, and my mom has this china that it's the special one and never used it.
Yes. So Joanne says thank you. That was very informative. So we appreciate you.
Very informative.
That was good. That was a good one.
Thank you for being here with us today. And remember, if you want all the information of all our guests, put your name on our form. We have a form where you can put your name and your email and all your information. We can send that information out to you. It's going to be the first season and second season all together, all smashed together.
So it has everybody's contact information and, a little bit about the company, so that you can keep that in a file. If you ever have to refer to it, you have all the information. So you
can refresh your memory a little bit. Yeah. And Denise, where they can find you?
I'm right here in my house.
In my house.
I'm on Instagram, on LinkedIn and Facebook, Denise Lanzarone. Your local realtor on Facebook, and find me at any of those places, or you could just give me a call, 631-922-5985, anytime.
And Daria, where people can find you?
You can find me on Facebook under my name. You can reach us on MX Elder Care on our Facebook page or our Instagram page. And on Instagram, I'm Daria's Roundtable, which is fun too. So any of those places, you can call me on my cell phone or text me 631-214-9613, or email daria.gentili@mxeldercare.com.
Gentili, and we're saying it wrong.
I went back to Gentili. It just, I don't know, it just came out that way. But I like the way Denise says it. Gentili. Sounds so pretty.
Well, and you can find me, Sandra Roman Real Estate, everywhere. Facebook, Instagram, and YouTube. Remember, if you're watching us on YouTube, please subscribe to my channel, comment, share this information, ring the bell. That's my song. Ring the bell. And if you're watching us on Facebook, either on Denise's Facebook page or my page, share the information. Follow us on Instagram. Follow us on Facebook. We're going to be live 4 more weeks at the same time, Wednesdays at 6 p.m.
7
p.m., 7 p.m.
7 p.m.
And it's a series for seniors and caregivers, because you know, usually the adult childs are the ones that have to make decisions, and sometimes we don't know what to do. So this is for you too. And thank you for watching us.
Thank you.
See
Thank
you
you,
next week.
Daria.
Thank you guys so much. It was fun.
Okay, that was great. Thank you. Have a good night.